Good afternoon, everyone. We're going to get started with our presentation for today. Welcome. I'm glad everyone's here today. I appreciate you coming. I'm Darlene Duncan, Vice President of Kenosha Women's Network. Today we have with us Mary Ouimet, who holds a Doctorate of Nursing Practice and registered nursing degrees. She's a result-driven, strategically focused healthcare executive who's been serving as the Chief Executive Officer at Kenosha Community Health since 2020. During her tenure, she has built a talented leadership team focused on working with individuals and groups throughout Kenosha, Racine, and Walworth counties to develop a new and accessible and affordable model of primary health care. This model addresses unmet needs for medical, dental, and behavioral care. She has also led efforts to brand this model of care and launched it locally at Pillar Health, which opened in the fall of 2022. Warm welcome for Mary.
Well, good afternoon, everybody. I'm going to do my best to talk about a topic that I could talk for hours about in 10 minutes. But I hope I leave you interested to learn more about this incredible gem that is here in Kenosha and soon to be in Racine County called the Community Health Center. So my background, we kind of went through that bio, but I was a chief nursing officer and I worked at St. Mary's Ascension, Wheaton Franciscan for 27 years. So I knew a lot about the community running healthcare systems. I knew a lot about hospital. When I was asked to come help out here in Kenosha in 2020, during a transition of the health center, I said, absolutely, I can figure it out. I know a lot about healthcare. What I came to learn is what an incredible gem and the incredible importance of a community health center to a community for all kinds of reasons, because it is there for all. It is a safety net organization, but it is a high quality organization. So there's a lot of confusion. There was confusion the day I started, and we've been working hard to so I've kind of been like a prophet on this. But I think more importantly, just more to share, like we've got an incredible health care system here to support the community. And so what is Kenosha Community Health Center is the parent company. And in 1995, actually I love it when Lydia's in the audience. Lydia Spotswood had the forethought to, it was during a very important time in the community, to look to write a grant to get a federally qualified health center in the city of Kenosha. And the importance of that, it cannot be underestimated, because what a health center is supported by a federal grant that allows the health center to care for those who are underinsured or uninsured, and really helps create a different model of care that wraps around individuals. So the question that's always asked, so what is a federally qualified health center? Because Kenosha Community Health Center and now Pillar Health is a federally qualified health center. So the question that I always said, well, what is that? Is that like a federal? People thought we were the health department for years. And it's like, because Kenosha was in the name, that was very confusing. But what it means is that we're eligible to receive a grant, the federal grant, which allows us to offer a sliding fee scale for health services. It also allows us to provide access to highly discounted medications through the 340 drug pricing program. So that's what we're eligible to have. But we are a standalone healthcare organization. Much like any other health system, where a health center is a cornerstone organization in any community. Communities fight to have this because it brings a lot of federal dollars to support individuals who are all kinds of individuals who need health services. So I'm going to put my glasses on to make sure I don't miss any points. So what is it? So we provide primary health care services that are comprehensive and high quality, and that is medical, dental, psychiatric, behavioral, and we'll be adding optometry and other services. The health center model is one that it reimburses care different than the hospital systems. because it allows you to actually do integrated care, and it really reinforces whole person care, because you could you can come to one place and have all of those services and so the fragmentation of healthcare that has evolved over really the last 20 years, the health center model overcomes it. So in my estimation, I've worked on both sides and all sides of this. It is a highly valuable model of care that can deliver outcomes that are far more effective for anybody. It doesn't matter what kind of insurance you have or don't have. It is an exceptional model of healthcare. So federally qualified means simply that we are eligible for the grant. And what we're not is we are not any public agency. We have no association other than we're great partners with all community partners, municipalities and whatnot. The way our services are developed, part of having the grant is we're required to build our services off community need. So what that means is that we have to evaluate what are the true needs of a community and design services to meet the needs accordingly. So we are regulated much like a hospital system, and that HRSA comes in and ensures that the quality is at the same, and I'll say it's at the same or higher level based on there's 190 standards that we meet ultimately, and so that's what's required to get to receive the grant. The other things that we're able, in addition to adult medical, pediatric, dental, adult and pediatric, psychiatry, behavioral health, which includes therapy for all ages. We have outreach and enrollment services, so we help people who need enrollment into benefits for healthcare, or we help them find other resources in the community for other needs they have, social needs that affect their health, and pharmacy services. So we connect them with 340B eligible pharmacies in the community. And so what does that mean to some people? Deeply discounted drugs. Some just high-level examples. We have individuals who normally their medication might be $13,000 a month, or some crazy number down to like $3,000 or down to $13. I mean, so it really helps many individuals stay healthy because now they can afford their medications. And so the 340B program is really a big deal. So we have 4 locations in Kenosha, and then including Silver Lake. So we are in Kenosha County. I think KCHC is a name that has been known for a very long time, with location on 22nd Avenue. That was the original site that was open, and that still stands, and that's where we have predominantly our psychiatric and medical services that are integrated at that site. We also have on 14th and 63rd a beautiful dental clinic. Absolutely gorgeous dental clinic with excellent dentists. So that's a very large dental clinic. So in the scale, that is a large dental clinic. We have the Pillar Health location on Washington Road, which is our new, and I'll talk about that in a minute, and then we have our Silver Lake location. Just recently, we were named the healthcare provider for Racine, the city of Racine, for their new federally qualified health center, and we will be part of their $65 million project. But it's because we currently serve a large number of Racine residents as well. So we're proud about that, but it's really because of our Pillar Health. So you say, what's the difference, and why aren't you all Pillar Health, or what's confusing? So during the pandemic, we knew that people were confused, and I was only there a month. And so I was a Kenosha resident, and I was like, wow, I need to figure this out. And I would ask around, and people were like, oh, you're the Kenosha County, or my own family a year or two into it still thought I worked for the county. Okay, so I mean, this is something that's not easy to really overcome. Why did it matter? But we went and we asked. We took the mobile unit. We had a mobile unit at the time, and I don't know if you remember the testing. We went out to Gateway and we did the testing there. We did the drive-through bank. We said, we're going to get out in the community and we're going to start to listen to people and understand their needs. And what everyone told us to a T, aside from they were confused and that name was confusing, that they needed healthcare designed differently, and they really were looking for a place. They're busy, they have a hard time navigating all these different health services, the fragmentation, even just their busy lives with their kids. They wanted a healthcare that they could come to one place where everyone knew who they were, and that it was efficient and one-stop shop. So that's where we came. We did a lot of work, and we had focus groups, and Pillar Health, your local health center, was the name that we selected because it had portability as the name grew, and we have a focus group we have a board, and we had a focus group of community members who felt that was probably a name that could stand the test of time. So Pillar Health is a different health product. It is a highly integrated care model where we have in the same clinic, not just co-located services, so they're down different wings. They actually reside next to each other: medical, dental, behavioral health. Pillar Health, we're piloting, and it's fabulous. Integrated behavioral health, primary care visits. So if there's any needs, a behavioral health specialist immediately goes in during the primary care visits as part of is a core part of the model. But likewise, we have the dental team right across the way, and integrating the dental visit. We're still building Pillar Health. We just received a $250,000 grant from Advancing Healthier Wisconsin and with the Medical College Partnership to really build this integrated model. We're already coming out of the seams at the site, but we're sewing together this integrated care model that should stand the test of time. So we're not all grown up yet, but when we do, I'm very confident that we will have a superior healthcare option for not just those who don't have insurance, but for all Kenosha residents, because we don't build health care for people's financial, because people move in and out of financial classes over a lifetime, right? We saw that during COVID. You build a healthcare organization that longitudinally can take care of you over your lifetime for all of your needs. So that's what we're designing Pillar Health to function like, and Pillar Health as a brand is that place where people call their health home. So I could go on and on about the model of care and whatnot, but we're happy to have. We're in the schools. We do Seal a Smile. We're throughout the community. So I'm happy to entertain any questions after the meeting, and happy to you can call me anytime.
Is there income requirements for going to the community health center?
No, it's for everyone.
So it's like going to a one-stop doctor's office?
Yes, that would be we want everyone to walk away with an idea that it is a one place you can go for everything. Yes.
Building on that, if someone had a medical need and wanted to come or wanted to enroll, you mentioned 4 different facilities. Is there one you should start with?
So, perfect question. For this very reason, we created a single intake. So when you call one number, and we put nurses on that intake so they can actually assess the need and triage to the right practice with the right type of provider. Because some people say, hey, I don't need all of that, I just want this. So we built a pretty robust nurse intake and triage for all patients, no matter what service.
Thank you.
Mm-hmm. All right, well, Rita, thanks for the opportunity.